Okay, so the pelvic girdle, this is actually going to consist of the two hip bones, which are also referred to as the coxal bones or pelvic bones. These pelvic girdles will attach to the lower limbs. They are very strong because they actually have to bear the body of the weight and provide mobility for the, not only bear the body weight, but also provide mobility for the trunk itself. It is part of the pelvis, and each hip bone will actually consist of three fused bones referred to as the ilium, ischium, and pubis. There's a socket that is on the lateral surface of each hip bone referred to as the acetabulum. This is actually going to be the meeting point of those three fused bones, the ilium, ischium, and pubis. And the acetabulum is the socket in which the hip joint will fit into. So looking at our hip bone here, we can see we have the ilium right here, okay? Then you have the pubis right here. This is going to be this rounded portion right here. And then you have the ischium here, okay? This is the acetabulum, which is formed from all three fused bones here. This point of attachment right here is where your other hip bone will meet. And there's cartilage right here where my arrow is. And that cartilage is very important because that's going to prevent this hip bone from rubbing up against this hip bone. And that cartilage is referred to as, it's fibrocartilage. It's referred to as the pubic symphysis. So when we look at the ilium, we have the greater sciatic notch. This notch is going to accommodate for the sciatic nerve. The accruate line, this is continuous with the pectineal line. And then we have an iliac crest and an iliac fossa. These are just landmarks. On the ischium, we have the ischial spine, tuberosity, and ramus. And then the pubis, we have the inferior and superior pubic ramus. And then the most important structure of the pubis here is going to be that pubic symphysis. This is where the pubic bones will attach to the pad of fibrocartilage, forming that joint between the two pubic bones. Also, the obturator foramen. This is a space that is encircled by the ischial and pubic rami. This is closed by collagen fibers that attach to the hip muscles. And your sciatic nerve is actually going to pass through the obturator foramen. And that's this big hole right here. All right, the pelvis is actually going to consist of two hip bones, sacrum and a coccyx. The pelvis is stabilized by very strong ligaments of the pelvic girdle, sacrum, and the lumbar vertebrae. And you have what's referred to as the sacral iliac joints. This is where the auricle surfaces of the ilia will articulate with the sacrum, and they are stabilized by ligaments arising at the iliac tuberosity. And here we can see our overall pelvis, okay? You have the sacrum, you have the two hip joints, okay? This is a sacral iliac joint, you know, between the sacrum and the ilium. And then you can see this would be the ilium right here, okay? Coming around here, this would be the ischium down here. This would be the pubis right here, okay? And you can see you have this pubic symphysis, which is fibrocartilage between the two hip bones. And remember that this is a lumbar vertebrae up here. This is all five, the sacrum, and in between the vertebrae and even to the vertebrae of the sacrum, you have a pad of fibrocartilage. Just to mention again, the importance of fibrocartilage is that it's very, very strong. It can resist a lot of tensile strength. This is looking at a posterior view, so you can see the back end here, and we can see the sacrum and the coccyx. Bones of the pelvis will include the pelvic cavity, and we have a true pelvis and a false pelvis. The true pelvis is inferior to the pelvic brim, and this will enclose the pelvic inlet, and the false pelvis is superior to the pelvic brim. The pelvic outlet, this is the opening bounded by the coccyx, the ischial tuberosity, and the inferior border of the pubic symphysis. And the pelvic outlet is where the fetus is actually going to pass through during childbirth. And you're going to see in a image in a second that the pelvic outlet in males is extremely narrow. Like, you're not going to get a fetus through that pelvis, just the way the angles are positioned of the pelvis. But a female's pelvis is angled differently to accommodate for this. And here you can see this would be the pelvic outlet right here. All right, so this is the true pelvis right here. The false pelvis would be this right here. Okay, so comparing the male and female pelvises, the female pelvis is much broader, smoother, and lighter. It contains less prominent markings. It has a shallower iliac fossa, wider pelvic outlet, and a triangular obturator foramen. And this is a nice image that really compares, you know, all of the key components of the pelvis between males and females. Okay, the male pelvis is meant to be able to withstand a heavier weight, but it also has a very narrow pelvic opening. The female pelvis has much wider pelvic opening, which again, that's really to accommodate for the passage of a fetus during childbirth. Okay, our lower limbs, they are going to function in weight bearing and movement. The bones of your lower limbs will include the femur, which is in your thigh, patella, your kneecap, tibia and fibula, which are in the leg, tarsal bones, and each leg will have 7. Metatarsal bones, each foot will have, or each ankle will have 7. I'm sorry, each metatarsal bones, each foot will have 5, and phalanges, each foot will have 14. The leg is going to be the distal portion of the limb from the knee to the ankle. And I'm actually going to pause for a second because I think our trash trucks are going by, and I don't want that to get too loud for you guys. So I will be back in a second. Okay, now that the trash truck has passed, I think we're good until at least the recycle truck comes down. But again, I think I left off with the leg being the distal portion of the limb. This would be from the knee to the ankle. So your femur, this is the longest and heaviest bone in the body. It is also the strongest bone in the body. Although, you know, if you hit that femur at the right angle, it can crack in half very easily. This is very common in car accidents when it gets sort of crushed at that angle, or skiing accidents. We see a lot of femur breaks. The head of the femur, which is the epiphysis, this will articulate with the hip bone at the acetabulum, and it will actually attach with a ligament at the fovea capitis. The neck will join the shaft at an angle of about 125 degrees. The femur will also have greater and lesser trochanters. This is really going to be for tendon attachments. And then we're going to have our medial and lateral epicondyles. This is going to be at the distal end of the femur, and this will actually form the basis of the knee joint with the patella and the tibia. So looking at the femur here, you can see it has a very defined head. You have the neck, the shaft, and then this would be the distal end where we have our lateral medial condyles. The patella, which is our kneecap, this is a large sesamoid bone. It forms within the tendon of the quadriceps femoris. The quadriceps tendon attaches near the base of the patella, and the patella ligament will attach at the apex to the tibia. And this is your patella. It's not a very, you know, there's not a lot to it. It really looks like a flat and round bone, or they actually call it a sesame seed shaped bone. I never thought it looked like a sesame seed, but a lot of people describe it as that. The bones of your leg, you have your tibia and your fibula. The tibia and fibula are bound together by the interosseous membrane. We saw the same thing with the radius and ulnar in the forearm. The tibia is your shin bone. This is a large medial. First of all, the tibia is the medial bone. This is also the weight-bearing bone of the leg. It is important to note that the fibula will not bear any weight. It is just there to help with muscle attachment. The medial and lateral tibial condyles, these will articulate with the medial and lateral condyles of the femur. They are separated by an intercondylar eminence. The tibial tuberosity is on the anterior surface, and this is actually going to be the point of attachment for our patellar ligament. The fibula, this is a small lateral bone of the leg. The head of the fibula will articulate with the tibia at the lateral tibial condyle. There is no articulation with the femur. This does not form a joint with the femur. The only bone that forms a joint with the femur is going to be the tibia and the patella, forming the knee joint. This is also different than what we see in the arm, because both the radius and ulnar do form a joint with the elbow joint with the humerus. So it's a little bit different than the arm. It's going to attach muscles that are going to be important for the feet and for the toes. It actually bears no weight whatsoever. The lateral malleolus, this is the lateral projection at the ankle. And here you can see the tibia and the fibula. Again, the tibia is your medial bone. The fibula is going to be your lateral bone. And you can see that interosseous membrane between the two, and the tibiofibular joints at either end. Okay. Your lower limbs, your ankle is going to consist of 7 tarsal bones. The talus, which will transfer the weight from the tibia across the trochlear. Calcaneus, which is your heel bone. This is the largest of the tarsal bones. The cuboid, this will articulate with the calcaneus. You then have the navicular. This will articulate with the talus and the 3 cuneiform bones. And they have 3 cuneiform bones, which are medial cuneiform on the medial side, intermediate, and lateral cuneiform on the lateral side. The intermediate is between the lateral and medial cuneiforms. Also, the cuboid and the cuneiform bones are going to be the bones that actually articulate with the metatarsal, the 5 metatarsal bones. So here we have our calcaneus. Here's the talus, navicular, cuboid. Looks like a nice little cube in there. And then we have our lateral, intermediate, and medial cuneiforms. Remember that big toe is always going to be medial. It's the medial side. Okay, so this could be the medial cuneiform. So you're working your way this way to the lateral side. Number 1 is going to be your big toe. So this is the first metatarsal, 2nd, 3rd, 4th, and 5th. And then the big toe will have 2 phalanxes, or sorry, 2 hallexes, which are 2 phalanxes. The hallux is your big toe. So you have 2 phalanxes, the proximal and the distal. And then phalanxes 2, 3, and 4, and 5, where you'll have a proximal, middle, and distal. So your metatarsal bones, these are 5 bones. They are numbered 1 through 5. And of course, now the recycler truck's coming. Medial to lateral, and this will articulate with the proximal phalanges. Again, the phalanxes, you'll have 14 bones, same as the hand. The hallux, which is your great toe, will have 2, and each of the other 4 toes will have 3. Okay. This is looking at a lateral view of the foot. Here we can see the calcaneus, again the talus, the cuboid would be over here, navicular, our cuneiform bones are here, okay, the cuboid is right here, metatarsals, and then phalanxes. Finally, the arches of the foot, they will transfer weight from one part of the foot to another, and there are 2 primary arches. The longitudinal arch will tie the calcaneus to the distal portions of the metatarsals. And then the transverse arch, this is the difference in the curvature from one side of the foot to the other. So looking here, we can see this is going to be our medial, the lateral arch, the longitudinal arch right here. The transverse one would be the one that's sort of going from one side of the foot to the other. Okay, and that is it for the appendicular skeleton, and that is it for exam number 2. Okay, I know I have joints listed. Joints will not actually be on the exam, but I will post a PowerPoint presentation on joints and assignment sheet for joints, but that particular chapter will not actually be on the exam or the identification as well. Okay, have a good day, guys. I'll see you guys later.